blood banks. Many of us heard that we should donate blood, maybe to save a person's life at a traumatic place or an accident. But really, blood is in many types of forms, of allergenic blood to donations and giving out transfusions, that it has helped some cases. But really, are there any types of risks for these types of transfusions? At any unit donated to a blood bank, allergenic unit or PAD unit might, 1, have administrative error, 2, fatal hemolytic transfusion reaction, a viral infection, just like sometimes we hear about HIV, hepatitis B or C, or even new viruses that we haven't even learned about. Bacterial infections, immunosuppression. For example, immunosuppression, there has been estimated that 10 to 50,000 people in the U.S. have died because of this cause. And even screening limitations. How do we know that a virus might not be able to mutate? We don't. So there are so many different risks that go behind accepting blood transfusions. But in the first time, why would anybody want alternatives to blood transfusions? In 1977, Dr. Denton Cooley performed the first bloodless open-heart surgery on one of the Jehovah's Witnesses on May 16, 1962. And in 1977, the team published a consecutive report of 542 operations without blood transfusions. And they said and stated that it was an acceptable low risk. And following with that, there was the Sanguis study. The Sanguis study was published in 1994. It was part of a concerted action of the European Commission's medical research program and a study to analyze blood transfusion rates in the major healthcare centers across Europe in 43 teaching hospitals, or prospectively study as to the routine transfusion rates for 6 common standardized operations. The Sanguis study revealed the different institutions routinely transferred drastically different percentages of patients for the same surgeries, varying from 0% in some institutions to 96% of others on coronary artery bypass surgery, and another surgery, for example, the total hip replacement, that range from 0 to 100%. After that, a follow-up study was made in 1998. It was done in Belgium. It says all types of hospitals were in this study in the same range of variabilities. So, to take this into account, we were noting that in different institutions, there were different rates of administrating blood transfusions. Sometimes, if there was one institution that gave blood at 0% and one institution that gave like 90%, we are administrating blood that is really not needed. But in the second study that I already stated, there was a positive note. 2 hospitals in Belgium changed their transfusion policy and have lowered their blood consumptions, like colectomy of cancer, and have come out with a shorter stay in the hospital, so there was the same mortality and morbidity rate. So, what are these techniques that surgeons and doctors are able to use instead of administrating blood? Well, there is a lot of pre-preparation before a surgery. So preoperative planning. So before a person goes into surgery, they have to know the certain red blood count, or the RBC count, the estimated blood loss, the blood loss, and then the transfusion threshold that can be allowed. So let's say that a person does not have an insufficient red blood cells in their system, and the estimated blood loss is major than the transfusion threshold. This can cause many problems in having to administer blood. But in going into iron therapy and administering erythropoietin or EPO can treat anemia and raise initial hemocritic by 45 to 50%. So if your blood count is higher in the initial or before the surgery, you can allow sufficient blood loss and not have to administer blood. This takes 10 to 21 days before surgery and can really, really help in not having to administer blood. Another technique, minimizing the bleeding. Did you know that positioning a person can minimize blood loss? And this could be very cost effective. For example, local venous pressure changes when the body is positioned relative to the heart. Lower pressure directly correlated to the blood saved. So for example, when one is positioned laid flat, the pressure is always equal. But when you change it, it'll change where the blood is accumulated or where it's not. That's one easy, cost effective. You just position a person correctly. Other techniques that I would like to expand on, but we do not have the time, are like normothermia, hemodilution, hypotension, meticulous surgery, hemostatic agents, the cell savage. I will expand on this one though. The cell savage is positioned so during the surgery they can recover the blood shed from the body, or from that the surgeon is losing. The blood lost by the surgeon is still not lost by the patient. This cell savage will pick up any blood loss, filter it from the debris and anything that might have gone with the blood, and some of them even wash the blood. And then when in a single circuit can also be administered to the patient. So it's the same blood that the patient had in the initial. This cell savage can recover up to 50% of the blood loss that would have been out the trash. So, take into these account all these ways of doing techniques of not administering blood. Can it be used in trauma or in intensive care units or in the ER emergency room? Yes. For example, they can do damage control surgery. This note addresses major bleedings, vessels, and then controls them. And then controls the surface with pads, and then closes the patient temporarily. And then the patient is taken care in the intensive care unit. There, they will take care of them with they will take care of the hypothermia, rewarming, and rapid rewarming as other techniques, so that way the patient is still able to survive that traumatic accident. So, Dr. Todd Rosengart has published 2 studies on blood conservation. In coronary bypass operations, where there were no administering allergenic blood transfusions. In this study, 50 Jehovah's Witnesses were compared with 100 general patients, and this has stated that they had a shorter stay in the hospital and lower costs. So, taking all this into account, alternative blood transfusions are safe, simple, and effective. People say that healthcare is very expensive. Why don't we save up on blood banks? There's a lot of studies that have, like we already stated, that they are administering too much blood and where it's not necessary. And take this, 150 countries and 100,000 physicians believe in these alternative blood transfusions. So, if you guys all think about it, there's no risk, there's no accidents in administering your own blood to yourself. So why don't we take the safe route and take the alternative blood transfusions as a simple, safe, and effective way of surviving a traumatic accident.